Hello, and welcome to Mic Check. I'm Karen White-Johnson. Thank you for being with us today. Our special guest today is Dr. Kimberlee Wyche-Etheridge, who is a pediatrician and currently is the director of the Bureau of Family, Youth, and Infant Health with the Metro Nashville Public Health Department. Welcome.
Thank you very much. It's a pleasure to be here.
Well, Dr. Kim, we wanted to bring you on because there are a lot of issues around health and wellness in our community. And with the latest shows that are coming on, like The Doctors, and with a lot of talk around infant mortality and childhood obesity, we felt that your expertise in this area should be shared with the Nashville community. So we welcome you here today.
Thank you. It's a pleasure to be able to get some of this information out to the community. It's really important that we understand some of the things that the community is suffering from so that we can all try to improve our health.
Well, let me just start out by saying, what is it that we in the community can do to help impact infant mortality?
Well, first, let's talk a little bit about what infant mortality is. If you're not familiar with it, what it is, it's when an infant or a baby dies before its first birthday, something that no family should have to go through. And unfortunately, Nashville and Tennessee in general ranks very poorly around the country as far as the health of babies. This is one of the worst places in the country for a baby to be born and make it to their first birthday. And there are a lot of reasons that we're seeing this. The major one is that women are not healthy before they get pregnant. And as a result, they're not having healthy pregnancies. Babies are being born too early, too sick, too small to survive. And as a result, we're seeing more and more babies having funerals instead of birthdays.
Is this a result of our not going for preventive health care, doing regular checkups? What is it that you're seeing specifically in the minority community as to why this is such a high problem in our area?
Well, there are a lot of reasons or a lot of things specifically that's affecting people of color. Probably one of the most important is the issue of nutrition and what we're doing, what we're putting into our bodies, and as a result making ourselves extremely unhealthy. Some of the largest people in our area are not necessarily have the most nutrition. As we know, we're doing a lot more fast food eating. Less and less people are cooking. We have an entire generation now that doesn't even know how to cook because they've never been in the kitchen. And as a result, what we're taking in, the number of calories, is much more than we're putting out. We're watching a lot more television, playing a lot more video games, and just being very sedentary. And it's simple math. The more you put in and the less you put out, the more weight you're going to gain. And just because of that alone, over 300,000 people across the country die every year as a result of something related to obesity, whether it's diabetes, whether it's heart disease, whether it's stroke, or anything else that can be related to the fact that what we're putting in our mouths is killing us.
Can you give us some information as to the new regulations that have been just recently put in place that will bring awareness on our menus with regard to some of what you have just shared? Is that something that will be able to help families, help mothers to understand what it is that they're eating, how to prepare more healthy meals? Do you see that having an impact?
Well, the best thing it'll do, it'll give people the opportunity to have informed choices. So if you're out at a restaurant, you'll be able to look at the menu and have an idea of how many calories you're going to be eating. And we don't really know when you're out what you're actually putting into your body. If the average adult only needs about 2,000 calories a day and a certain number of grams of fat, and you go to a fast food restaurant, I don't want to call anyone out right now, and say supersize your meal, you're actually eating almost 3/4 of the calories for the entire day in that one meal, and almost 2 or 3 times the amount of fat that you need for the whole day. If you do that once a week for a year, you're going to put on weight.
So how can the average citizen in the Nashville community find out what they can do to become more healthy in terms of their eating habits? Is there information on the Nashville.gov website? Where can you find information? And if they do not make regular visits to the doctor, what do you recommend?
Well, first, I definitely, as a physician, especially want to recommend everyone that they get their preventive health. If you don't have a doctor, and you're assigned to an MCO or to a health plan, make sure you meet your doctor and you go and visit them, or your practitioner, or whatever your provider is. If you are not insured and you are eligible for insurance, I highly encourage that you utilize it. If you're someone who's not eligible for insurance, there are other programs available through the state health department or even through the local health department that can help you get coverage, and I think that's important. But the thing about providers is all we can do is help identify what's already gone wrong and help to hopefully give the information to keep you from having to be in that situation. If we're able to affect our youth, especially, about the importance of weight and weight control, then we'd be able to decrease the number of children and young adults that are getting diabetes, and the number of adults that are suffering from diabetes, and the number of middle-aged and older adults that are seeing the final effects of diabetes, whether it's renal failure, requiring dialysis, problems in the eyes causing blindness, whether it's poor circulation, which is causing amputations or losses of limbs or toes or other things like that, or eventually even death. So preventive health is definitely important, definitely. But being an informed citizen is key. We have to take control of our own health. We have to be the ones that are our own best advocates, whether it's reading the menu labels or reading labels and knowing what you're putting in your body, or reading menus when those calories are on there and knowing that if you eat 5,000 calories a day, you're not going to be healthy. And until we get healthy and get our women healthy, we're not going to have healthy babies or healthy children.
Thank you, Dr. Wyche. You know, we know that this is a Nashville problem, and many people are committed to trying to reduce the numbers of babies who are in this state. And so whatever information is available that we can get out also through the school system, we look forward to doing that as well. Can you tell us a little bit about what you're also doing with Metro Nashville Public Schools with this initiative?
Well, first, I think it's important that we, again, realize some of the things that goes into not having a healthy baby, and it all boils down to not having healthy women. You can't have healthy women unless you have healthy young women, which means you need healthy girls, which is where the school comes in. Improving or increasing the ability for young girls and young boys to be able to get physical exercise, to learn the importance of moving and being active, not just when they're kids, but throughout their entire lives, is key. So programs that are enabling kids to exercise outside of regular PE or even after school, partnering with the community centers or the Y or other groups that are coming in and doing some exercise programs is key. Teaching kids the importance of nutrition, as we said, so that you grow up understanding what it is that you should and shouldn't be putting in your body, and really understanding what it means to be a healthy young adult in all aspects is something that all children need to know in order to start off an adult life healthy.
And you also said on many occasions that women, that we live with more stressors than protective factors. Why is this the case?
Well, just to clarify, there's a lot of work that's being done on what's called the life course perspective, which basically is showing that what happens to you as an adult is directly related to what happened to you when you were a young adult, a child, an infant, and even in the womb. And as a result, things that we're able to control early on may not have as much effect later on. But what we're seeing now, especially with the economy being as poor as it is, with people losing their jobs, losing their houses, people are extremely stressed. And when you're stressed, stress can be a chemical reaction in the body that in a perfect world, you get stressed in a situation of danger. If you think of, if you're being chased by someone, you want to get stressed so you're able to run faster, you're able to see better, and you're able to get out of danger. But then your body is supposed to relax, and that is a normal cycle. When you're stressed continuously, your body doesn't get that opportunity to relax in between stressors, and that can be detrimental to your immune system, to your heart, to your body in general. And what we're seeing is people who tend to be very stressed we're seeing long-term effects, whether it's the heart disease, whether it's increased risks of strokes, or other things like that, including poor pregnancy outcomes.
Well, thank you, Dr. Wyche-Etheridge, for coming today and sharing such valuable information with us. What would you like to leave us with today that can hopefully give the Nashville community an opportunity to impact this positively?
I think that if we really as a community focus on making sure that our children have the best start that they possibly can, that every child deserves to be born healthy or have the ability to be healthy, grow healthy, get the information they need to keep themselves healthy, and the resources that are needed so that they can actually practice what they learn. I think that would be the key, because once our kids are healthy, we'll see a healthier community.
Thank you.
Thank you so much.
Thank you for what you do also.
You're welcome.